Okay, so welcome everyone to the London School of Paediatrics start preparation evening. We've got Su Laurent, Opute and Jane Runnacles as TPDs talking about the process, and Meret is our, we lost from London, but is here to talk about her experiences as of start as a trainee. So first of all, Sue, do you want to go for it?
Thank you very much, Katie, and thanks for inviting me back to the start evening. So I'm just going to give you a little bit of an outline about, what is it all about, how did it come about, and what should it feel like to you as trainees, and hopefully Meret will agree with me. So a long time ago, the GMC said that every specialist group of trainees needed to have some kind of an exit exam, and they used the word exam. But luckily, the School of Paediatrics thought, do you know what? Well, actually, it's the Royal College came up with the idea that we wouldn't have an exam, an exit exam, but we'd have an exit assessment. And the word assessment really is that you cannot fail start. And that's my first message to you this evening. You cannot fail start because it is not an exam. It is just a look at where you are in ST7 and as compared to what we're hoping you'll be like as a first year consultant. So we're looking at the kind of skills that are expected in a very new consultant. And the idea is that you have to go through 12 stations, which will give you different scenarios, all of which are real life scenarios, which have all been put into the pool by lots of consultants from across the country who will be in a situation and they'll think, that would be a really good start scenario. So they will write it up and they'll put it in and it will go in. And then all the scenarios get benchmarked with all the assessors who are doing it on that day and the next day, so that we're sure that we're all looking for the same kind of things. We're all expecting the same kind of things. And so I'll give you sort of examples of the kind of scenario. So there's always going to be a prescribing station. So, accuracy in prescribing, please just make sure. And I know when you're panicking and you're kind of, I've got to do this in this time, it might be much harder. But nevertheless, just try just to describe like you would always prescribe. Just fill in all the boxes, be accurate. There's always going to be something that's going to be a bit safeguarding-y. And there'll always be a teaching station. So you'll have some virtual students to teach, and you'll be given a topic and you just teach them about it, and you'll be watched doing that. And there'll be other stations. There might be a station like a handover station, or a station where you're accepting a referral back from a tertiary centre, and all of these things are things that you're going to be doing all the time in your job at the moment. And I cannot stress this enough. What we're looking for is your thinking skills, your problem solving skills for your stage in training. And between each station, we all get 8 minutes. We get 8 minutes to write your feedback, and you get 8 minutes to read the next scenario so that you're preparing yourself for the next thing. For the sort of feedback we're going to be giving is feedback about, what you did really well, and maybe there's anything that we think it would be helpful for your development. As I said, we don't give you've passed, you failed, but there will be everybody we expect to get some areas for development, because in 12 stations, you're not going to get through with everything 100% perfect. So do not expect that. But these areas for development are all things to discuss with your educational supervisor, and then to put into place something which will address what those areas were for development. And then those of us who do ARCPs will be looking at ARCPs to make sure that you've addressed the areas for development and you're moving on. Sometimes there'll be scenarios which will be asking you to use common sense. And so there may be a rule in your hospital that you have to do this, but whatever it is in the scenario doesn't quite fit that rule. And you might have to say, well, do you know what? In this situation, as a consultant, I would handle it in this way or that way. Just try to use common sense. I'm going to stop talking now and see if there are any questions.
Hi there, stick your hand up or stick it in the chat and you can read it out.
So while we're waiting for questions, I'm just going to share some of my slides, which really kind of summarizes what you've just said. and if I'm able to, because some of you already know that I'm quite technologically challenged. Preparing your slides. Can you see my
Yeah, we absolutely can. Yeah.
I have no idea why. I'm just gonna stop presenting this one. Sorry, this is not what I want to do because it's not. Okay, let's share something that's a bit more. Yeah.
Can I ask Meret, while we're looking for that, Meret, is there something that I've said that doesn't ring true with you, or did it not feel like that when you did yours?
No. Generally, that's pretty much what I was going to say. I think the timings have changed slightly, and the number of stations have changed slightly. But when I contacted the Royal College today, they said there are going to be tweaks, and they tweak it each time. So, for example, I had 10 stations in my diet, and they were 8 minutes of chatting and 4 minutes of preparation between each one. But I think they're constantly tweaking it, and that's kind of the thing that they were very keen to iterate, that like none of this is completely set in stone, but that they will send out, and they did for my one as well, like a video that prepares everyone a few weeks before it. So whether it's 8 stations, 10 stations, 12, whatever, but it's so kind of roughly. Yeah.
That's a very good point, and they do change all the time, and we all as assessors, we get retrained every time, because not only do the timings change and the numbers change, but also the technical side of it changes. So they use different platforms. So just when we've got in our head a whole new platform, they'll suddenly say, do you know what, we've got a much better one now. Yeah. So we'll have to learn a new one, and we'll have to make sure that our computers can cope with them. So absolutely, yeah. So just read what you get. I don't think you need 12 stations, actually. I think, 10 or 8 is probably plenty. And also we get little breaks now. Before there was no breaks, so you were just kind of typing, and then moving on. Now there is a little gap, so you can go and have a cup of tea and a wee before the next one, which is helpful. Margot has said, how much do you need to revise for it? I would say very little, because actually it's all supposed to be testing skills that you have attained anyway at LST7. But I don't know whether, Meret, you feel that's quite wrong, and you feel that revision is a really good idea.
Well, if we think about it in that these are all skills that are going to be applicable to real life anyway, then whether you're reading it now in preparation for the assessment, or whether you're going to be reading it anyway, these are all kind of documents. I think at the end of reading them, I felt, oh, that's actually quite useful for real life. So if you can read them beforehand, why not? It'll help you feel a little bit more confident going into the assessment, and just give you that extra bit of confidence. There's a Trello board that we have with various articles that previous candidates have put forward as useful, and I used some of those because I thought they were quite useful. Things about when do you do a post-mortem, for example, what's the child death review process like the ethics behind withdrawing life-sustaining treatment, those sorts of things that maybe we don't get exposed to on a day-to-day basis, but we will need to know for those kind of rare occasions. I thought they were.
That's really helpful, actually. Thank you, because I think if there is a collection of documents that people have found helpful, they're documents that will also help you in consultant interviews. So it's kind of good preparation for this point in your life. So even if nothing like that comes up in START, it would be helpful to just have that knowledge when you become a consultant. So is your Trello board easy to access? Can everybody access it? Because we've got people coming from everywhere at the moment.
I'm putting it on the link now.
Oh, excellent. Excellent. And Tricia has said, do you have any tips in managing the virtualness and your time, managing your time? So Meret, can you answer that? Because I'm in a panic the whole way through as an assessor.
So my one big top tip would be just check that you've got Wi-Fi, and B, that you've got the browser that you're using is compatible with the software that the RCPCH are performing on. Just because I had a colleague who was sitting the same diet as me, and for some reason their browser wasn't compatible, so they moved on from station to station and they weren't able to pull up the questions that were being set forth. So just make sure that your browser is compatible. In terms of timings, now I think the RCPCH are using programs that move you from one station to the other automatically, so you don't need to set any timers on your phone or anything like that, and it comes up with a countdown like a minute before the end of the station. It's like a red flashing countdown marker that's very obvious in the middle of the screen, so you will know when you are almost about to end, and it will take you directly into the next station without you having to click anything. So it's all pretty straightforward.
That's a relief to me, I have to say. So I don't have to do any timing anymore. That's wonderful.
Yeah. No.
So no, that's really helpful advice. And I think that the thing, I suppose, that as the question comes up in front of you, just make sure you do read the question thoroughly. You know, a good example will be you'll have a handover list, and you'll be asked, the question will be, and you'll be told how many members of the team you have, how many staff you have, what grade they are. You'll have a handover list and you'll be asked, okay, how will you prioritize your morning? And you'll be thinking not only who we're going to go and see first, but maybe who might go and see that person. Would you dispatch the registrar to go there and an SHO to go there? You know, would you want to get somebody to go rush down and organise an ultrasound scan first thing, because you know if you don't do it first thing it might not get done. It's that kind of thing you'll be thinking about.
Yeah.
Anne, would you like to present those slides, and then maybe
Okay.
I'll get some.
So I'm just going to go really quickly, and I'll stop and talk about some of the so the process and applying for it, and in terms of what it means for ARCP and CCT, because that's what you know, that's really when it becomes quite important. So some of you might wonder what START stands for. It's an American term. I'm sure they could have found something British, but anyway, so it's tenure is your consultancy really. So it's as Sue says, it's an assessment of where you are in terms of your very first year consultant. So sometimes there's a gap, and I think, as Sue says, we expect to have those gaps because you're not yet a consultant. You're a trainee, and actually even as a consultant we're all still learning and training. So it's not pass or fail, it's very formative rather than summative, and it's developmental. So it's meant to really sort of give you cues, and also it also helps you the other way around as well, to kind of identify or reinforce your strengths, because some of us are naturally good communicators, and it's always nice when that comes out, because it just reinforces what you know about yourself or what people have told you on the clinical floor. So you can do it at any point during level 3 training. Well, I say at any point. The college now is very clear that they would want to know what your Cct date is, and so they don't want people sort of doing it too early, because actually when you think about the assessment, if you're doing it so early, then actually you're going to be really far off, and it's not very helpful for you. So the best time really is the latter part of ST7, which means you need to start thinking ahead, because if you wait till just before you think you want to sit it, and there are no spaces, particularly if you're a subspecialty trainee, then you'll end up doing it in ST8, which is rather stressful, because we do want you to have at least 6 months whole time equivalent of training time to work on any areas that might be flagged up, any gaps, you know, and also for it to have been seen at your penultimate ARCP if possible. It's held 2 to 3 times a year, and there's some ad hoc days that are thrown in because of the we've had quite a bunch up because of COVID and moving to the virtual scenario. But I think the college has started to catch up now. It is going to be virtual, and as Sue says, there's the the stations. The feedback from each station is quite detailed, and I think sometimes it can be a bit overwhelming, but try to kind of look at the gist of what is being said. So for instance, with communication, there'll be 5 subheadings. So sort of look at each one and discuss with your educational supervisor. That's what we say. And actually think about, reflect on the assessment. What does it say about you? What do you think? Were there any surprises? If they were, where were the surprises? What are the gaps? Where are your strengths? That kind of thing. This is the way the feedback comes. So above expectation. So that's generally for someone who might be performing beyond the first year of consultancy, meeting expectations, which a lot of trainees will be at, and further development required. Again, the college is quite keen to stress this does not mean that you are failing or there is anything wrong with you, but it just tells you really that there's some areas that you probably need to work on before you apply for your consultant job. And significant concerns, thank God we very, very, very rarely get those. But because it's a clinical interaction, if there's something about the trainee during the start assessment that really makes the panel, the assessment panel worry, that will be fed back to the head of school for that diary, and they will have the trainee, we've met a trainee or 2 in the past just to sort of go through and make sure they haven't sort of, it's just a one-off and does not call into question their revalidation. So for ARCPs, when we start to review trainees at ST7, we start to look to see, have they applied for START? Have they done it? And if you haven't, we will say something about, please try and make sure that you're applying for START. We want to see evidence that you've thought about START, your START assessment. So even if you have no developmental aspects to your feedback, we want all trainees to reflect on it, because I think Meret was she said it perfectly, that it really helps you in your day-to-day work. So critical appraisal station, for instance, how many of us sit down, and I certainly know that I don't, to actually kind of think through, perhaps when you do journal club, how do you critically appraise a paper? It's just nice to have gone through that and think, well, okay, next time I do journal club, I'm not going to overthink it, because I already know these are the steps that I need, for instance. So we want you to reflect on your START assessment. So you don't have to do remediation. Remediation means, and I think we should change that word, Sue, I think, because if we're not saying it's pass or fail, remediation kind of means that you're trying to kind of, I don't know, make an excuse or something. So maybe we should just take that away and just call it START reflection. But we want to see evidence that you have reflected on the assessment, that you have discussed it with your educational supervisor, and actually your education supervisor mentions it in their education supervisor's trainer's report. Whilst it's not an exam, an exit exam, as Sue says, every specialty has got an exit assessment stroke exam, and the GMC will not give you a CCT without it. So it's absolutely mandatory. So whilst it's not a pass or fail, it is mandatory. So the ARCP panel cannot issue you with an outcome 6, and you cannot CCT. So it's vital that you do this. I've just got one or two examples of how trainees at ARCP in their e-portfolios have reflected on their START assessment. So this was a trainee who had identified the learning need from the feedback from the stations, how she addressed the learning need and what the evidence was for that particular station. And she put the dates that she'd achieved it. So this was helpful for her. Some trainees use, I think there's a PDP tool in Kaizen, which my college tutor colleague today was saying she did not like. So you may need to use that. I'm not sure Meret might answer that. I don't know if you have to use the PDP in Kaizen, but I quite like this. This one I even prefer from the first one. So this is actually just going through station by station. So it's more methodical. So the critical appraisal station, what did the trainee think about their performance, were there any developmental needs, and how he or she is going to meet those. So really, don't make it a tick box exercise, make it work for you. Engage with the process and just think about this is yet another step up to being a consultant, and this is going to help you not to pass this so-called assessment or to do well, but actually to be a great consultant, to actually showcase your skills, which you spent years fine-tuning, really. So yeah, that's it.
Yeah, thank you, Anne.
Can I just add to that, please? Thank you, Anne. It's a really, really good summary. If we ever do think that a trainee, there are significant concerns about a trainee, we always, the assessor always discusses it with the sort of adjudicators who are on duty for the day. So we might say, this is what this trainee, how they approach this scenario, and it really worried me that, and we all have to be clear together that we agree that it's a significant concern. It's not just one consultant saying it's a significant concern. I just wanted to reassure you, and that's probably why we don't get very many of those. And sometimes when the rare occasions where we do get significant concern, it will just be with the same person. There'll be a significant concern in several areas, but it is very unusual. So not to worry about that. Hi, Jane.
Hi.
Hi. How are
you? Jane, would you like to talk for a bit now, and then we'll get some more questions? Or...
Yeah, sure. No, that's fine. Hi everybody. For those of you who don't know me, I'm Jane Runnacles. I'm a paediatrician at St George's, and I'm one of the TPDs for education. And I did do a recording, which you can watch on YouTube from August 2020, which is a crash course in quality improvement. It starts at 1 hour 44 minutes into the recording of that start evening, and I'm not going to do that presentation again because you can all go away and watch it if you're not familiar with quality improvement. But essentially the reason why I did that talk previously is to give a bit of a framework for the logistics and organisation station, to kind of give you some signposts to how to approach a scenario around service improvement, even sort of building a business case. There might be something more perhaps in the conflict and risk management scenario around patient safety and governance. And so what I would recommend that sort of I suppose my tip or advice would be to think about hanging your answers for those scenarios onto some sort of structure, and perhaps some sort of tools or quality improvement approach that you are familiar with. So it may be, so in the crash course, I talk a lot about the model for improvement, which is the kind of widely accepted approach to quality improvement that we teach NHS. We also teach sorry, my incoming call. So we also teach it on the QI Change Champions program, which is a LSP course that's on the list of approved courses for your study leave. So if you're feeling that quality improvement or service improvement is an area that you don't have experience of, I would recommend that you come and join our course. It's a way of working on a local project over 16 weeks, and you get mentorship and support with that to a level which you'll never get again. And actually, even if you don't do it for start, if you do it before you become a consultant, I can guarantee it'll be one of the most useful things you'll learn in terms of the other aspects of your role as a consultant in the future. And it might be something you reflect on in your in your start in terms of how you're going to address that in your ST7 or 8 year. So what I was going to say was think about structuring your answers. And the important aspect with these scenarios is if you're given something around improving a service or addressing an issue, a safety problem, being asked to think about building a business case, the most important way of structuring it is, number one, to think about understanding the problem. So, understanding how to get the data, how to sort of demonstrate that there is a problem or an issue, but not just to demonstrate it, to understand it a bit better. So really trying to sort of map out a process. So you might use a process map, you might use a fishbone diagram, and these are all things you could reference when you talk about this in your start station. Thinking about your stakeholders, so who are the right people to involve, who do you need to get on board, and it's important to think outside of your immediate team and to think about sort of outside of your department, who else there might be in the trust or externally who'd be important to engage in understanding what the issue is. Thinking about your managers, your service managers, your general managers, who can help pull data, and sort of being able to talk around this problem, show some maturity and experience when it comes to these scenarios. Obviously, if you've got real life quality improvement experience, that will be, set you ahead. But think about the words, the phrases, the approach that you would have in terms of stakeholder engagement, understanding your problem a bit more. And then the bit that I talk about also on that presentation is about the model for improvement. Everybody's heard of PDSA and it's thrown around a lot. Oh, I'll do a PDSA to test this out. But the most important bit are the 3 boxes at the start of the model for improvement, which are aim, measures, and change ideas. So really being able to understand your problem, you can then articulate a clear aim of what you want to achieve. So again, in your logistics and organisation station, some tips for answering something around service improvement or building a business case is to be really clear what your aim is and make your aim smart and measurable. When you look at your measures, being able to think about how you can show that any changes are an improvement, and then to think out with all your stakeholders how you're going to test out change ideas. So I suppose the relevance for start is that this could be a nice structure you could use. It's something you could fall back on if you get one of those sort of scenarios that you're maybe not quite clear how to approach it in a structured way. And I would say that particularly for the conflict and risk management, try and attend some management and governance meetings so you've got a better understanding of how it is we approach incidents. So thinking about the DATEX system, how we respond to them, how we look at themes, and I'm always encouraging and very happy for our senior trainees to come along to these meetings. They have a bit of an understanding. What is the risk register? What does that mean? Thinking about governance structures within a trust. And all of this is so important for your consultant interview. So this preparation now is going to be really valuable because it's stuff you need to know for your consultant interview. So, in your consultant interview, you're bound to get a question on, a patient safety issue, or a medical error perhaps, and being able to talk about duty of candor and understanding kind of escalation and structures within your trust is equally important for that as it is for start. So there's a lot of overlap in your preparation. It's all going to be important. And I think the last thing is around preparing and talking to people in the team. Find out who your clinical governance lead is, who your lead for QI is, looking at attending management meetings, but then also testing out your answers to some of these things. So use some of the example scenarios to actually practice structuring your answers, because I think, again, we know this from interview, that how you structure your answer and how you present yourself is just as important as the content of what you're talking about. So really try and practice to time, because you are obviously limited in the time you've got. So, you know, practice this. Think about a few different scenarios, you know, service improvement question, something about building a business case. They're all along similar lines. You need to get the right information, the right data. You need to understand what the issues are. You need to get the right stakeholders involved, and then a structure of how you measure your improvements. You test out changes. You continuously collect that data so that you can then demonstrate any changes you make as an improvement. And often for a business case, you'll need to have tested it out on a small scale to show that actually, you know, you can demonstrate the evidence or the benefits in the long run. So yeah, I don't think there was a huge amount more I was actually going to say, but I'm very happy to take questions, or please chip in to what I've said, and you know, happy to stay around for some Q&As as well.
Yeah, I think structuring your answers is something really important, and yeah, I just highlight that again, because it and making sure that it sticks to time, because there is very limited time. I think we had 8 minutes for ours. It felt like it was way shorter, and you wanted to make sure that you had all the right pieces of information in. So just make sure that you are kind of practicing to time. And there are a lot of scenarios on the Trello board from previous stations that have gone by. So do use those, because they're really good, and often very similar to what came up in our assessment as well. Katie, I have 10 minutes of bits that I was going to talk about, but do you want to maybe see if there's any questions for Jane, and then I can finish up?
Yeah, perfect. Any questions or
I should just also point out, there's just something about, I get a lot of requests for changing Cct date. So if you're fast tracking, if you're thinking of fast tracking, it's really important then, and you haven't done start, clearly your Cct date is going to change. Otherwise, what is on ePortfolio, college will look at it. So if they get a request from Opute, GMC number XYZ, they'll go to my ePortfolio and they'll look and go, well, her Cct date is March 2024. Why does she want to do a start? Nope, we'll put her on, you know, waiting list, even if I apply, you know, in good time. So if I'm fast tracking by a year though, and wanting to CCT next year, then I haven't had an ARCP to change my CCT date, and they would need to see evidence from your TPD or head of school that your CCT date is changing. So for that to happen, you need to have completed a fast tracking form, because that has been signed by your education supervisor, because your TPD or head of school has no way of knowing that you're actually on track to CCT early, or may not know. So please don't just ask for a CCT date change. Also email whoever you're sending the form to just sort of say, I've discussed with my education supervisor, and I want to fast track, and I need to do start earlier now. And then we could, because they won't give you a place until they see confirmation that your CCT date is changing. Just something to bear in mind. I think that's all I wanted to say, and wish you guys all, well, I don't wish you luck, because you don't really, it's not luck. I think, you know, it's making it work for you. It's not a tick box exercise. It's actually using all that, considering that, as Meret says, you don't get that in your day-to-day on the clinical floor, because you're so busy doing the work that nobody says, oh, come on, Meret, let's go to this management meeting and all of that. And suddenly you just find you're doing start, and you've never done some of the stuff that Jane's talking about. So it's a great opportunity to start to prepare for being a consultant and that consultant interview. So it's helpful on every front, and it will never be time wasted.
Yeah, absolutely.
No other questions in at the moment, so maybe, Meret, if you chat for a bit and people might think of some things.
Okay, yeah, great. So thank you, Anne, and thank you, Jane, for going ahead and saying quite a lot of the stuff that I was going to say. So it's only just a reiteration of some of that that I'm going to now present, but hopefully won't go on for too long. Just 10 minutes of your time on things that I thought were quite useful, like when other previous trainees had talked. So I'm just reiterating them to you guys now. So the college, when I contacted them a couple of days ago, they were very keen to say that, as I said earlier, that the format is constantly being tweaked. So I had 10 stations. It might not necessarily mean that you have 10 stations, but it was 10 stations and 2 rest stations, and they were 8 minutes long and 4 minutes prep time, other than the prescribing station, which was 16 minutes prep time and 8 minutes of discussion. The whole thing lasted for me for about 2.5 to 3 hours, and we were put in a virtual room, and for like the first 10 minutes until everybody joined and everyone was ready, and then you just click join once, and then the whole software takes you from one station to the next. We didn't have any breaks in between the stations, but I don't know if that's going to change with subsequent ones. And the person who you're meant to direct your discussion with tends to be the biggest face on the screen. So for most stations, it's only one person, because it's just you and the examiner having a discussion. But for the teaching station, there will be, so I had 2 medical students who were there. Their faces were the kind of the bigger faces, and then you could see that there was an examiner's box, but they were kind of to the bottom right, and clearly they were there just to kind of observe rather than interact with you. And all the stations, in that 4 minutes, you just have that time to prepare, and you don't get a choice in the questions, other than in the teaching station, where they give you 2 scenarios, so 2 things that you could teach on, and then you pick one of them to teach on, and they tend to be very easy topics, such as like how do you manage bronchiolitis, or explain the signs of respiratory distress to these new medical students. And that was the only station where you had to direct it to the medical students and not to the assessor. The critical appraisal station, you get given the paper 1 week beforehand, and that then allows you the time to appraise the paper. And the most important thing, though, at the end of that station is to make sure that you say, how will that affect your clinical practice on a day-to-day basis, having then gone through all the evidence in that paper. And in the prescribing station, don't worry, you don't need a BNFC. They'll give you a drug monograph, and you'll be able to work off that, and all the information will be there. The only thing I'd say is that often in the stations, they will clump 2 things together, or maybe more than one thing. So for example, like you might start off with a clinical scenario, and then you where something has gone wrong, so you'd have to talk about clinically how would you rectify it, and then talk about then the significant incident and how you would manage that, in terms of, for example, how the DATEX process works, how do you escalate. And what about if it's a trainee who made a mistake? How do you manage and supervise that trainee? So that's just something to be mindful of, that they try and kind of like incorporate it into what would be in real life, that you're never faced with just one thing on its own. With the people who are good trainees, you have about, so we had 10 stations. 7 of those stations will be general paediatric stations, and then 3 for us were subspecialty stations. But if you're a general paediatrician, then all 10 should be general paediatric. So my stations were one on critical appraisal, and that felt very much like a monologue. I just kept talking and paused every now and again to check if the examiner wanted to ask me any questions, but he didn't, so we just kept talking. But other stations you'll have, it will feel more like a discussion. And I guess that just depends on your style, the examiner's style, what the scenario is. So don't be put off if sometimes it feels like a monologue and at other times it's a discussion. So my stations were critical appraisal, handover, and as Sue was saying, they might give you like a list of patients, all with various levels of clinical severity. So for example, like a Jehovah's Witness patient who has a HB of 2, and then a 6-month-old day 6 broncholytic who hasn't required any oxygen overnight, and then the mental health patient who's awaiting CAMS, and then another patient, for example, who is threatening to abscond. And they'll give you a list of who you have present on your team. So you might have a registrar and a GP trainee, for example, and a senior staff nurse. And so then you kind of discuss who you would allocate to which patient and in what priority would you want to see those patients. So that tends to be the format of the handover one. Prescribing one, so as I mentioned, it was a hybrid for me, in that you had the drug monograph, you had to kind of look through it carefully and explain what exactly the error was that had been made, talk about how you would clinically rectify the error, and then in my case, it was a trainee who had misprescribed something, so looking at how you would then remediate that, and how you would escalate it. And then there was a safeguarding one, which was a very kind of comfortable discussion about how you would start safeguarding investigations. Then the teaching station, and then I had one clinical station, which was purely clinical, and then a management station, which was very paediatric emergency department specific, talking about breach reports. But I don't think that's something that would probably be relevant for most other specialities. And then I had 3 other stations, which were responding to a complaint, an ethics station where and it was an oncology patient who wanted kind of to end her life essentially, and her parents were wanting all treatment to be given. So how you as a consultant would kind of try and broach that situation. And then a last one, which was a kind of trainee in difficulty, who was a foreign trainee. There was a bit of a language barrier and a bit of kind of altercation between that person and one of the nursing staff, and how you would go about kind of managing that situation. So I felt like they were all actually fairly relevant to real life. And so as we said earlier, it's not pass or fail, but it does help if you have done some preparation for it, just so that you feel comfortable walking into it and talking to the examiners. And they do set you the standard of being a day 1 consultant. So even if you get in the assessment feedback that needs a little bit more development, then it just means that you're at the level of a senior trainee and not yet day 1 consultant. So it's not anything to feel awful about. It is there to guide you in your last bit of training as to what you kind of need to hone in on and focus on. Your feedback comes to you about 6 weeks afterwards, and it comes so that you can then start putting together a start PDP on Kaizen. It's helpful. I think it was helpful for me to just see what things I could improve on. So yeah, it's there for learning. So my 10 top tips to finish off, because I'm sure you're all hungry and want to go have dinner, is number one, form a study group. It really does help just to kind of talk through scenarios with other people, and then, as Jan was saying, kind of have a structure, come up with your own structure with your colleagues and practice talking to time. Number 2 is use the Trello board. It does have some, it can feel overwhelming when you first look at it because there is just so much stuff on it. But there are some useful scenarios on there. There's some documents, for example, how to make a case, a business case study, or child death review process. Those sorts of things are useful on there, so do take time to look at that. Number 3 is practice to time. Number 4, check that your browser is compatible. So I mentioned that earlier on only because one of my colleagues had a very stressful assessment when they weren't able to load up the questions that were being asked. Number 5 is have a pen and notepad with you to hand, just because in that 4-minute prep time, it will allow you to jot down some ideas that you can then talk about in your discussion for the station. Number 6, like Sue said, just be careful to read the questions carefully and think a little bit more about what else might they ask you, or what else might they be looking for. So not just the clinical situation that you have to remediate there and then, but also kind of going on thereafter. For example, how could the department improve on that situation? Is there a quality improvement project waiting to be done, or is there does this need to be escalated to a significant event, and does a datex need to be put in, and all that sort of thing. And then number 7, eat well and sleep well the night before. Just make sure that you are in a good frame of mind. And then take a couple of snacks with you so that it's 3 hours long, so a snack or two won't harm in that time. It can feel like it's quite a long slog. And then finally, just put yourself in that consultant role. Sometimes if you're anything like me and you sometimes go through imposter syndrome and kind of feel like, what am I doing here? Really do try and think of yourself as the consultant going in on your first day. And that really does help to kind of just get you into that frame of mind. And then have fun, because it is relevant to real life. And as we said before, it's an assessment. So it's only there to help improve your performance for later on in life. And it's not there like to, there's no punitive aspect to it. So yeah, enjoy it and make it work for you, as Anne was saying.
Thanks, Meret. I think all of our TPDs have had to run at this point, so it's just you left, but I think there are a couple of questions, and do stick any more in the chat or put your hands up. There was one about the teaching station. What do you do if it's something you're not sure about, and do you get given it before the critical appraisal? First one.
So the teaching station, you don't get given it before. It's something you only get given those 4 minutes to prepare. So it does feel slightly short of time because you have to make a decision about which of the two you're going to talk about, and you have to prepare roughly what you're going to say. But it does tend to be very basic stuff. Like I said, it'll be like, how do you manage bronchiolitis? Or teach this medical student what are the signs of respiratory distress in a neonate, or something very, very simple, because they're not really testing you on your knowledge so much, but more on your interaction style with the medical students. Are you kind of addressing their questions? Are you checking their understanding as you go along? All that sort of thing. So I wouldn't worry too much about the teaching station. If anything, it's one of the more enjoyable ones.
Yep.
And did you say there was another question about the critical appraisal?
No, that was the same question. There's one about, can you see the information during the station, like the handover? Can you refer back to it?
Yeah, exactly. So there'll be like a little kind of box at the bottom that you can scroll up and down on, and that will have the question that was given to you in the preceding 4 minutes. Yeah.
Great. I don't think there's any other questions at the moment. I'll give people another minute. I'll just pop in again a whole list of links. So there's the LSP Start Trello board that's got lots of useful things on. The LSP Start WhatsApp to ask things and share things, and also to then people have branched into other little WhatsApp groups from that to practice. Yeah. The LSP YouTube channel. So this recording will go on here. Plus, there's all sorts of other topics that are probably useful, things like about leadership. There is on there this previous session from 2020 where a few people gave longer talks on topics that come up often, like critical appraisal, quality improvement. So do have a look at that. There's also a feedback form if you are feeling enthusiastic. Fab. There's one more question. You're doing it at home virtually, yes?
Yeah, so they said for the foreseeable future it will still be virtual. So yeah, you can choose where you do it. Yeah, in the comfort of your own home, probably.
And one more. There's a couple more coming in. Can you see them now?
Yeah. So was the subspecialty scenario similar to the CSAC review? I'm not sure what you mean by the CSAC review. Do you mean like your interview when you were in grid, when you were applying to grid, or something else? But they tend to be kind of like a little bit specific to your area. And for example, like mine, it was a mixture of a clinical situation and then they added on responding to a complaint. So how would you go around about responding to a complaint? So just be mindful. Sometimes they try and put two things together in the same one. And then as a less than full-time trainee who is accelerating, I had to jump through quite a lot of hoops to get a start date. What does it say? Sorry, because I can't. Highly recommend sending emails in advance. Okay. Other than grid trainees, if you have done spin modules, will your scenarios be different? No, I think it's just if you're in grid, then it's you get some subspecialty, but if you're a general paediatrician, it's all general paediatrics there. I'll have to say I pass about whether it's the same as the CSAC review because I'm not sure, I'm sorry. But it tends to be something specific to your subspecialty. That's all I know. Okay.
That seems to be all the questions for now. So thank you, Meret. Thank you to the TPD. And thank you everyone for coming. I'll stitch it up as soon as possible and share the link.
Yeah, and thank you, Katie, because you're always the one who's like on the ball and organising this. And thank you, Christine, for also so much for coming in to help out to organise all the tech side of things. So really appreciate it.